During that first pregnancy, I had series of complications. I had infection. I was taking the antibiotics every month. Almost every month. I was taking antibiotics, treating malaria and typhoid every month. And those antibiotics trigger fibroid.
Okay, so you know I'm a mother to so many babies. Jcms babies they are over 100, and they are in different states. And unfortunately, I've not been able to meet a lot of them. However, we have a Jcms baby in Calabar. I came to see our bundle of joy. Sam, please, can you show? He's sleeping, and you know, interestingly, we have more male babies. I'm telling you, I don't know whether Jcms is helping for the fertilization of male sperm because the majority of our babies are male. You know, one of the painful or the most confusing fertility issue is the secondary infertility. What is secondary infertility? Secondary infertility is a fertility that occurs after someone has given birth to a child or have been pregnant before. Okay, you know, her story is quite an interesting one and also a heartbreaking one. As I am this morning, I'm super excited for this bundle of joy because it is quite painful when you have your child and then you walk out of the hospital without that child. That's the experience of Michelle, and I want her to share it because there are so many women there or couples who have gone through secondary infertility, and it can be very painful. Michelle, how was it like, and what happened after that?
My name is Michelle. I got married, and then in 2023 I got pregnant, and then I gave birth through CS in 2023, and my baby was sick. It was a very traumatic experience. We were in the hospital for like 3 weeks or a month, and then we lost the child. And then after we lost that child, I had a miscarriage. And then after that miscarriage, I was suffering from hormonal imbalance and PCOS. It was very difficult for me. And then during the time I lost my child, that was when Jcms business started. I think a few months after Jcms business started, and then I became a distributor. In fact, I will need to go through the journey of that first pregnancy because I will need to relate it with this present pregnancy and baby, so that you know what the power of Jcms is. During that first pregnancy, I had series of complications. I had infection. I was taking the antibiotics every month. Almost every month. I was taking antibiotics, treating malaria and typhoid every month. And those antibiotics trigger fibroid. In my second trimester of that first pregnancy, I had multiple fibroid. We went for scan and there was fibroid. And I was supposed to deliver normally, but I couldn't. So because I'm immediately CS, they couldn't remove the fibroid. I was supposed to do another surgery to remove the multiple fibroids. And then next, I saw my CEO, my mentor, started advertising Arabian tea then before she chose me spices. And then I bought a distributor's pack to use for myself. And then I took the tea for 2 months. And one day I went to the toilet and I betted those fibroids. There were 3. I betted them in the toilet. And then that was how my breakthrough started. From betting the fibroid, my hormones were corrected, and then the PCOS was taken care of, and then I got pregnant for this baby. But before that time, it was difficult because I had lost a child, had a miscarriage, and then I was suffering from hormonal imbalance and PCOS. My menses was not regular and all of that.
And so, the fibroid.
Yes, and the fibroid. So fast forward to this pregnancy. When I got pregnant for this baby, I was not taking Jcms from the beginning because we were not sure then if pregnant women, yes, it was for pregnant women. And then at 7 weeks, a threatened miscarriage. I just woke up one morning and then I started bleeding, and I rushed to my CEO and mentor's inbox, Mrs. Jinjugo, and I told her. She told me to go and boil multiple because I was scared, but she has never misled me, so she has always, there's nothing she has told me that I did that I regretted, so I just obeyed her like I always. I boiled the multipurpose, I drank. Within 24 hours, I stopped bleeding. I didn't go to the hospital. I not started antenatal then. It was after it was at 7 weeks it happened, and then it was at 12 weeks that I entered antenatal with this scan, and the baby was okay. Nothing happened to the pregnancy. And then during this journey of this pregnancy, I never took any antibiotics, even one day. There was no infection, there was no blood pressure issue, there was no threatened diabetes during pregnancy. I treated malaria just once in 9 months, compared to the last pregnancy that I was treating malaria every month, treating typhoid every month, taking antibiotics for infections every month. There was no antibiotics, there was no typhoid, and I did not treat any malaria except once during the 9 months. And I started taking Jcms from that 7 weeks that I had that threatened miscarriage until I put to bed. And that was the reason why I had no complication. In fact, anytime I go to the hospital, the nurses tell me they don't want to take my fetal sign, they want that I'm always okay. The gynecologist will tell me there was no point checking you. This is how when you're always okay. I will insist that they should check. You know, my blood pressure was always around 105/70 throughout the pregnancy journey. And then I gave birth, and I started taking Jcms immediately. And within 2 weeks, the blood stopped, like I stopped bleeding. And in less than a month, I resumed bedroom activities. I was telling my mentor the other day that she was asking me, on chat, and I told her that I would resume bedroom activities. So, are you not experiencing it? I said, I'm not experiencing it. I started using even tummy wrap. I'm telling my stomach, I'm not feeling any pain. But I gave birth those years, and all of this is because of Jcms. So, it's been a wonderful journey. They say this second pregnancy was different entirely from the first. In throughout the journey, and even after I gave birth, you can see the baby is healthy.
As in over healthy.
The baby is healthy.
Our baby is so pretty, and he's so peaceful. So if you are a woman who just gave birth and you've been going through psychological stress because of the stress and all the changes that comes with new baby, I think you should look for Jcms spices multipurpose. It will help you. How is your breast milk?
Yes, breast milk. I was telling you the other day, Mama, I don't have appetite. I don't eat much. Sometimes I eat like twice in a day or so. But I lactate very well. Like, I'm even surprised. In fact, my husband calls me a milk factor. I lactate very well, And then the Jcms I'm taking, which is also helping baby. He doesn't have issues with colic, and then stooling too. Like he
passes very okay.
Yeah,
you don't have to start keeping him and wrapping his tummy.
No, or do all of those stuff. In fact, we are complaining because he pulls like an adult. He pulls like you can pull up to 3 times or 4 times.
What a cutie! We are talking about you.
It's amazing and easy because of Jcms. Yes, I would say that I recommend Jcms for every pregnant woman and nursing mother. It is a must-have for you and your baby, because apart from this thing, it's also helping to build his immune system.
Yes.
And the infections and all of that.
You've not had any fever,
flu, nothing. Wow,
this is amazing. Please carry him. Sorry. So you see, childbearing and pregnancy is a journey of its own. It's a serious journey of its own. I used to encourage women who are pregnant or even before you get pregnant. So Michelle, have you ever thought what would have happened if you didn't come in contact with Jcms? The secondary infertility. There are those who have suffered this secondary infertility for 7 years, 8 years, 10 years. Because imagine having multiple fibroids, having PCOS, hormonal imbalance in one person.
Yes. And then the trauma I went through from the first experience.
Yes.
The pregnancy, the loss of the child illness, the financial, the debt we went into, and all of that, all of those trauma.
Was the essential thing that Jcms even cleared all of those.
Yes, it cleared the financial burden, it cleared the health challenges. The mental
stress of debt and all of
that, it cleared it. So I was just 8 months in this challenge. I 8 months to 1 year. So I imagine people who have been suffering infertility for years. what they have been through and all of that. So I just thank God that I met Jcms when I did. Yeah, it came right on time, and I'm grateful to God for it, and I'm grateful to you too, my CEO, for bringing this amazing business and product to us.
Stop right. You're looking. I'm here. So this is it. If you're on my page, there is no need of you to suffer with that primary or secondary infertility. You don't have any need of that. There is no need of you doubting. You don't have a need of doubting these products. Take it. There is no harm in trying. It does not matter whether you have taken. Some people say they've taken more than 10 this thing, products. We've used it. You have, see, like my distributors will say, there is Jcms and what? Other things. There is Jcms. There is no comparison. We don't have anybody. It's only Jcms and others. So you try Jcms today, and we are looking forward to hear your testimony.